I'm Dr. Korey Partenheimer. I'm board certified in orthopedic surgery and fellowship trained in adult reconstruction, hip and knee replacement, and I practice with SLUCare Physician Group. The patients I see in clinic are hip and knee pain patients, most commonly 50 or above, but even patients of all ages. I'm usually seeing arthritic patients, patients that, like I said, have pain or have limited function or range of motion in their hip or knee. I also have specialty training in redos or patients that have had prior hip or knee replacement that have had issues with them and they need them looked at and need them basically redone. The most common goal is pain relief, but ultimately pain relief for what? For better function, so that they can get back to the things they want to do. Most commonly, if it's taking care of grandkids or, even going to the zoo with grandkids. I think the best thing is being able to see a patient, after they've gotten through the recovery, when they come to me, and sometimes to the point they're so debilitated that, they don't have anywhere else to turn, and then see them get that life back, see them do things that they tell me they haven't done in years. It's just probably the most rewarding thing I can think of. The simple fact of seeing somebody be able to get back to, their life, and you help them do that.